The number of dengue cases has significantly reduced compared to previous year. According to a report from the State Department, the state has confirmed 81 dengue cases this year, while last year the number was 2,548. Recalling the high prevalence of dengue last year, Health Minister Dr. Sapam Ranjan stressed the necessity of collective effort to combat the disease. Speaking at a media briefing at the conference hall of the Directorate of Health Services on July 23, Dr. Ranjan informed that the state has confirmed 81 dengue cases this year. Among these, 29 cases are from Imphal West, 20 from Imphal East, 13 from Thoubal, 9 from Bishnupur, 5 from Kakching, 3 from Chandel and 1 from Kangpokpi district. Due to the overwhelming number of dengue cases last year, the Health Department has taken all possible measures to control the outbreak, but public support and participation are also essential. In the last decade, dengue outbreaks have reached peripheral areas, affecting not only Manipur but other states as well, he added. Cautioning against taking the problem of dengue lightly, he noted that such cases were usually reported during the monsoon season, but are now being detected throughout the year. Experts have pointed out urbanization and population growth as the main factors for the rising dengue cases, he stated. Assuring commitment to control the situation, he said that along with the state malaria officer, the department is taking measures to manage the outbreak. The minister also emphasized the need for coordination with other departments to implement effective control measures. ASHA workers are actively engaged in source reduction programs by visiting homes and eliminating stagnant rainwater that could become potential breeding spots for mosquitoes. The Health Department has discussed with the Social Welfare Director to incorporate the assistance of Anganwadi workers and helpers in tracking domestic breeding spots, Dr. Ranjan maintained. He also appealed to the public to cover water tanks. The department is undertaking activities like fogging, awareness programs, medication of mosquito nets, and sensitization programs through All India Radio, he added.
Ashas khapta ngasai sa Health Department khapta ngamoy manam praja singna akoi hojik radio jingles adum tawri media cover kagas adum akoi hapsari sigi sida akoi participation the praja pumnamak taina appeal tawjari akoi sing tungaga se yam samna haibada gamla da ising tungaga leiba akoi gari gi tire yumdaga chum thamba kanjida keno tawrga leiba syntax akoi ising water containers the hapam kuptana suma smaina sum leibaze masisida su dengue marum kokkum macha kokkum macha umoi sesida koi siri isa koi mayam community koi na koi clubs the organization topa gaso koi coordinate tawraga koi adum pangtoktuna lai duga koi domestic breeding checkers aina koi asha singji koi asha singji ni am toina haisibni moi role yam chawi moi ke through the moi ke help through the zone kano tawri aya department atopa says social welfare department of wari sari through the anganwadi workers help through the koi sig awareness se adum spread tawna na bidam ka koi hona minasi hadana koi am toina director ke through the personally isagi koi ke minister sarji koi wari sarga koi kan hona sari ana khwaidagi maruina ngasi media personal channel now so da ngasi press can press with them quite a maruina, a praza individual amount, participate, dominance in a